Thank you very much for having me here today. As the chairperson has said, my name is Brian Kearney. I'm from Ireland. I'm here to talk to you about the role of a clinical engineer in healthcare and hospital management. And I'd just like to attribute some of this talk to a colleague of mine, Peter Granger, as well, who's sitting up there, so just to pay credit to that. So, before I get started, can I just get a hands around the room as to who's a clinical engineer in a hospital? And who's in industry? And is there anyone here that's working in hospital management? Yes, great, okay. Okay, so the reason that I'm here to talk is just to show you my journey as to how I got to the hospital manager role, starting from an engineer, and just to maybe back up some of what the previous speakers have said in terms of the application of engineering principles into operational and hospital management. There's a brief outline of what I'm going to cover. It's not very technical, it's quite overviewish, and it's just to give you an idea of how I got there. So, in terms of my background, in terms of education, I did a Bachelor of Engineering in Electrical Electronic Engineering, and I went on to do a Master's of Science in Bioengineering while working as a clinical engineer. I also did some studies in project management and some studies in executive leadership as I moved into the executive management team of the hospital. I worked on quite a lot of projects. Our clinical engineering and medical physics department in the hospital cater for quite a lot of large-scale projects such as MRI, power generation systems. So I got a lot of experience in terms of the operation running at a hospital from managing those projects. I then moved on into operation management, chief operations officer, and I work as a hospital manager in Ireland as well. So I suppose when we look at healthcare and in terms of trying to manage healthcare, I've seen it described before as a two-headed monster. So you have medical and maybe not so medical professionals working alongside, and we're trying to deliver patient care in what's a very, very fast growing and changing environment. Clinicians are very knowledgeable in their field, but often their skills in terms of being able to manage and implement service introductions isn't always as good as what they are in the medical and clinical field. I just put this slide up. It's a bit busy, but it shows you the structure of healthcare in Ireland. You'll see up the top we have a Minister for Health, and you see these layers then from our Director General within what's called the Health Service Executive in Ireland. I suppose what I wanted to point out was currently the system is, down here on the left we have these hospital groups, which are the acute system, so the hospitals, and then on the right we have our community system. They report into different fields, which has been quite significant in terms of how healthcare has changed over the last 10 years, because the motivation to move patients from an acute setting into the community setting and trying to get them back home isn't always clearly there, because the funding doesn't always move with the patient. So if we look at the healthcare challenges, before I start talking about the engineering side, I think we all know that there's an increasing population and a very aging population, especially in our over 75s, and that does put pressure on the system. There's a huge mismatch between the supply and demand of the workforce, and I think that's predicted for the next 10 to 20 years. We're planning to see a workforce, certainly in Ireland, we're seeing a lot of people who are emigrating out of the country, and we're currently trying to get them back, so that does put a stress on the service. The technological advancements, which I think everyone around the room here is well aware of, but also bringing the healthcare to the home and the service user, which is, I work in an acute hospital, so I'm very interested in how we can get the patients out of the acute hospital as quick as possible, because if you're not supposed to be in there, it's quite a risky place to be in terms of infection. We have increasing regulation, and we always have budgetary constraints and trying to do these things as lean as possible. And all those challenges while also trying to maintain a high quality and safe service. If we look at the medical devices and the information technology, there are huge advances in medical device technology. We have the AI coming in. We have things like for home-based healthcare, the wearable devices, and even the regulation around those, and how we manage those and how we transmit that data is massive, how we get that data back to the specialists in the hospital. If you look at the IT and medical device integration, certainly there's a crossover of technology, there's a crossover of professions as well, and working with your ICT colleagues in the hospital who maybe aren't as familiar with the application of the technology but are very familiar with the software and the IT technology and network security behind it. The data systems, I suppose, I often put up this slide which I find is quite powerful, that 90% of the world's data has been created in the last 2 years. So we're inundated with data, and the trick is about trying to find out what's relevant and try to pick out the good data from the bad. If we just look at clinical engineering as a health and social care profession in Ireland, just to make a point of the structure of where we are, we're here, our colleagues in medical physics are here. We sit in a group which encompasses all the therapies and the diagnostics, so you have the likes of physiotherapy and so on as well. So I suppose it puts us in a field that we are very much at the patient bedside. So why clinical engineers if I'm trying to convince people to go into hospital management? Well, if you look back to the ACC definition from 1992, it's a profession who supports and advances patient care by applying engineering and management skills to healthcare technology. So I suppose at the very start of it all, it's quite clear that there's huge management skills built into engineering and engineering education. So the profession of engineering, I suppose what does give us an advantage and can put us ahead of some other engineering disciplines is that we know and we respect the clinical environment. We know how important it is. We also understand the clinical aspects of healthcare. We're trained to understand the terminology of it. It comes as standard that we have the engineering practice and the principles that are taught to us in our undergrad and postgrad degrees. And we specialise in applying this medical technology to the patient in the hospital and at home. So I just pulled up some of the skills that we often extract out that an engineer has and trying to match them with the healthcare challenges. And it's quite clear, I think, to see that some of the skills such as being analytical, detail orientated, having an attention to detail, they all have a good comparison and a good cross-reference with the healthcare challenges. You'll see a lot of what we're doing requires the skills of an engineer to put that methodical and logical thinking behind some of the problems that we have. So being in the hospital management situation, it obviously gives you a voice at the table, which is a member of the senior management and executive management team, but you can inform and promote the rest of the executive management team on health technology management, which aren't necessarily au fait with that. We will have accountants, we'll have quality managers, we'll have nursing colleagues who might not necessarily be as well informed in healthcare technology management. You become central to decision making, and I suppose putting a structure in that decision making. It's very easy to get emotional about what's happening in the hospital because it really, when you're there with the patient, you see how things are affecting the patient and the patient's family. But putting quite clear structures in place as to how we analyse these business cases for new services means that we can create a good reputation and create a high level of trust with the healthcare system that allows the system to invest into us into the future. You're also dealing quite a lot in hospital management with quality, risk and patient safety, and a lot of my work would be to do with serious incidents and incidents where a lot of times patients can be seriously impacted or can die. So applying an engineering methodology, collecting the facts, analysing them and coming back reporting on the conclusions has huge benefits to the patient. The operational issues, some of which my previous colleagues have discussed, I won't go into detail, but it is very clear how engineering methodologies can be used in these operational challenges, and also how we manage change management. It comes as second nature to us to manage change, and often that can be a slow moving feat in healthcare to try and make change happen because of how delicate the system is and how important it is to get it right. So again, that attention to detail and the change management is important, I feel. And the HR management is probably one of the biggest things I do in the executive management team now is dealing with people. And the ability to bring people along and bring people with you is something that's really important, and I think engineers inherently have to be team players and have to be able to work as part of a team, so you, in my experience, become very well accustomed to what needs to be done there. This is just an example. I'm conscious of my time, but the application of engineering in management, I've started to create the likes of the KPIs that some of my colleagues have wrote about. In terms of operational management, patient flow, looking at admission rates, trying to look at mathematical correlations and statistics between what we're doing and how we perform in the hospital to services that we provide. And I've also developed a new system for our allied health professions, for the likes of the physios, the clinical engineers, the occupational therapists, to focus on their KPIs and relate how they perform to how the hospital performs as a whole, looking at what we do from the emergency department to when we get discharged. So I suppose with the challenges, just going back to review it, keeping patients out of the acute hospital is currently where I'm focused, and putting my engineering head into how to get the technology back out there and connect to the acute hospital, and also empowering the patient to manage their own healthcare. The data is a massive challenge that we have, and how to translate that to actually making a change, because we have so much data. How do we actually implement change from that? The irregulation, I've spoken about the cost effectiveness and the budget control. A lot of my work is to do with finances, and we're not getting any more finances as the increase in population goes up, so it's important to be lean about that. And one of the major things I would say is bringing people with you, so the communication aspect, which I think as an engineer comes natural to you. So, thank you.